Hello, everyone. The topic I would like to talk about for our abstract is the impact of COVID-19 on upper GI tract stenting and dilatation service. How do we prioritize, keep scoping, and training? The abstract is to describe our experience during the initial wave of COVID-19 pandemic in the United Kingdom. The COVID-19 pandemic had profoundly affected the endoscopy service, including therapeutic gastroscopy across the UK. In order to continue providing the service and protecting the staff and patients, the BSG issued guidance for managing endoscopy service safely throughout this period of time. At the beginning of the pandemic in March 2020, a symptoms-based questionnaire was used to screen patients for COVID-19 prior to their endoscopy procedures in our hospital. COVID-19 swab were only carried out if patients presented with COVID-19 symptoms. From 18th May 2020 onwards, in addition to the above approach, all patients attending endoscopy procedure underwent a SARS-CoV-2 nasopharyngeal swab at least 3 days prior to the procedure. Audit was carried out from 18th of March and 31st of July. All patients were followed for 30 days. Full PPE were used during this period of time. For the 4.5 months during the beginning of the pandemic, 42 procedures were carried out. 31 were esophageal dilatation, 8 esophageal stent insertion, and 3 pyloric dilatation. 81% of procedures were carried out as outpatient. All procedures were performed under fluoroscopy guidance, with 97.6% of the patients had a confirmed histology. 92.9% patients had undergone imaging prior to their first procedure, and all procedures were technically and clinically successful. There were no procedure-related complications or mortality. There were no COVID positive swab in the 30 days post-procedure period during the entire study period, and trainees were present in 50% of the procedure. None of the consultants or trainees who were involved in the procedure were diagnosed with COVID-19 during this period of time. One of the nursing staff members who regularly assists in the fluoroscopy room was involved in a non-fluoroscopy diagnosis endoscopy procedure in a COVID-19 patient, not known in the time of the procedure, and subsequently tested positive for COVID-19. Our study confirmed that a high-quality stenting and dilatation service of the upper GI tract, together with specialist registrar training, can be delivered safely and effectively during the COVID-19 pandemic in appropriately prioritizing symptomatic patients.